Texas is seeing its worst measles outbreak in nearly 30 years. State health officials confirming close to 50 cases there. Over a dozen patients have been hospitalized. The majority of them are minors. Now, according to the Texas Department of Health Services, all patients are either unvaccinated or their vaccination status is unknown. Joining me now, I have Dr. William Schaffner, a professor of medicine at Vanderbilt University Medical Center. Doctor, it's always good to have you. Texas Department of State Health Services says the cases are confined to a rural Mennonite community in West Texas, but they're worried the numbers are premature. What does this all mean regarding possible spread, you think?
Well, Markie, this is a very contagious virus. Measles, we think, is the most contagious virus. So clearly it could continue to spread in this Mennonite community. And because people travel and see friends in other parts of the country, and those people visit those folks in Texas, we could see this spread to other under-vaccinated communities in other states. Every single one of these cases and all the hospitalizations could have been completely prevented. I would ask people across the United States, if your children haven't been vaccinated against measles today, take them to your pediatrician or family doctor and get them vaccinated.
And that's that MMR vaccine, right? Correct, sir?
Yes.
Okay.
Yes, MMR, measles, mumps, rubella, which is German measles. It's all combined in one vaccine.
It's just awful to see some of this video of these children suffering. It looks so painful. Doctor, health officials say Gaines County, Texas has one of the lowest rates of vaccination in the entire state. Talk to us a bit more and elaborate about herd immunity. You know, we heard that a lot during COVID. How does it help keep outbreaks like this at bay?
Well, when we talk about herd immunity, we mean the proportion of the population that's already protected. And given that this is the most contagious virus, measles, we need over 90%, well over 90% of the population to be immune in order to prevent contagion, in order to prevent transmission. And that's why every state across the country has rules that say if you go to daycare or school, you have to have your child vaccinated. You know, we were able to completely eliminate this serious disease in children by having everyone vaccinated. But with parents withholding their children from vaccination, there are pockets in communities of unvaccinated children where outbreaks could occur if the measles virus is imported and finds its way into those communities.
Yeah, and you bring up a point that I also wanted to touch on. There's an obvious distrust in vaccinations right now. Your message to parents out there about getting more informed on the science of it all. You know, I know a lot of new parents, too, who are like, man, my child is getting a whole lot of vaccinations in such a short amount of time. What's your message to parents, sir, who don't really know what to think or how to move forward?
Always talk to your child's doctor, the pediatrician or family doctor. And remember, these vaccination regimens are recommended by the American Academy of Pediatrics and the American Academy of Family Physicians. They wouldn't recommend anything that is not in your child's best interest, but talk to the doctor that's taking care of your child.
Yeah, absolutely. Dr. William Schaffner, I have to end it there, but it's always a pleasure, sir, and we appreciate your time and expertise.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.